So today I wanted to talk about back pain in pregnancy. So as you can see, here are our hips and they are nice and mobile, but here's our tailbone, and the baby, we want to be sitting like this, right? So that way the baby's backbone is against our tummy so that he can kind of hang forward. But sometimes the baby's backbone is this way and is against our backbone. And that can often give us a lot of pressure when we're sitting. Especially if you're sitting and you sit back and relax, you're sitting on that tailbone. So we want to sit, first of all, up a little better so that you're sitting here so that the baby can hang forward. Or if the baby is in the anterior position, which is what we don't want, but if the baby is this way, the baby will kind of perhaps roll forward. So I'm going to show you an exercise to do with that. So getting up on your hands and knees, it's very easy. It's a cat and a cow. Just let your belly fall down and let your back arch and stretch. You'll feel the stretch along your back and along your tailbone, and you'll feel the weight of the baby in front. And then you're just going to rock the baby back up like a cat. Curl your back, and then just go back down. And this relieves a lot of that pain that you're experiencing, and you'll feel the pull in these muscles back here as well. And just do that, and rocking the baby like that. If the baby is in that wrong position where his backbone is against your backbone, hopefully doing exercises like this will encourage him to, one, move out of this position. If he's down so far that he can't really turn, leaning like this, you're kind of letting him fall into the uterus a little more, giving him the space to turn to be where we want him to be. So that'll relieve that pain on your sciatic nerve, if that's the problem that you're having. It's also going to relieve the back pain that you're having from the baby sitting on your back. And it can help the baby move to the right position. So remember, when you sit down with the baby, you want to be sitting forward, not on your tailbone. Don't lean back into it. Sit up. If you need to put a pillow or something there when you're driving or even when you're sitting on your couch, then do that. But you want to sit forward. And then finally, the last thing that we have to remember is how we want to bend down and pick things up to help our back. So if we're picking up our 2-year-old, what we don't want to do is bend over and pick them up. Instead, you're going to want to squat, letting your belly hang between your legs. Let your child come to you, climb up on your leg, and then stand back up with your child if you have to pick up a child. Otherwise, if you just need to get something off the floor, squat, get whatever you need, and stand back up. If you need to hold on to something to stand back up, then do that. These squats also open those hips and help them practice and give them that flexibility that they will need when you're in labor and the baby needs to descend and come through. So hopefully this helps relieve all of your back pain and your sciatic nerve pain and helps you have a happy and healthy pregnancy.